Welcome to Snooze Worthy, a podcast by Parenting Practice of Colorado, your window into the world of pediatric sleep, where we explore the science behind sweet dreams, effective sleep teaching techniques, and all the intriguing nuances of your child's slumber. I'm your host, Lindsay Birchfield.
And I'm Paige Legault. Together, we're here to guide you through the labyrinth of parenting, offering insights, strategies, and science-backed advice to make parenting during those early childhood years not just manageable, but truly memorable.
As pediatric sleep specialists, we've seen the transformational power of sleep in countless families.
And because parenting is a journey, we won't stop at sleep. We'll provide you with valuable parenting tips for every aspect of early childhood, from managing tantrums to fostering creativity and hitting those all-important milestones.
So whether you're a seasoned parent in need of a sleep overhaul or a new parent preparing for the joys and challenges of early childhood, Snooze Worthy is your trusted resource. Join us as we unravel the science of sleep, share practical advice, and make parenting truly snooze-worthy.
Welcome back to Snooze Worthy. I'm Paige Legault.
And I'm Lindsay Birchfield.
And today we're going to talk all about cry it out, which is a big, scary term.
Yeah. Did that give you all the feels already?
It did, yeah. It makes people very uncomfortable. And it also, just as a mom, right? Like, no one wants to hear their baby cry.
No.
Of course not. But the formal term of cry it out is extinction, which just means total elimination from parental support.
Yep.
So when clients come to us, when we're having that first conversation with them before they turn into a formal client, right, our sleep evaluation call, they always ask, well, is your method cry it out? And there's a lot of big, loud voices out there that talk about cry it out, good, bad, and ugly.
Yep. And
so it's a pretty polarizing phrase. And most people don't actually know what it means or what it is. So what cry it out is extinction. So what you would do if this is the methodology you're going to go with is you would do a bedtime routine. You would place your baby into their own sleep space, so their crib in their own bedroom, no parent or person present, awake, and you would say goodnight and you'd leave the room for 10 to 12 hours straight. You would not return for any reason. You will not go in if they're sleeping peacefully. If they are screaming their heads off, puking, they've taken their diapers off, you leave them fully alone, full extinction of support. And Cry It Out was created a long time ago.
Yeah, a really long time ago.
1892 by the father of pediatrics, which was Emmett Holt. And his reasoning for why we should let babies cry was to expand their lungs, right? Mm-hmm. To keep them healthy. And that was the thought process around it. And of course, to get parents sleep. Like when you need sleep and you don't know what to do, you ask your pediatrician.
Right.
Right. And so if that's the only method that parents are being told, they're going to do it and they're going to trust it.
Right.
And then when you're in it and you realize how brutal it could be for you and your family, it starts to make you have all these feels.
Yes, a lot of feels.
I would never be able to do that to my own child, let alone anyone else's baby. Like, we've never advised that. That's not what you're going to get here.
Absolutely not. No.
And so there's another methodology that is also very popular that we get asked about all the time, which is Ferber. Mm-hmm. And Ferber came about in 1985 by Richard Ferber. Mm-hmm. He created it, and he was a physician. And so basically what Ferber is, it's an answer to Cry It Out. Right. It's kind of the middle ground of co-sleeping and being 100% available for your baby all night long to cry it out. Mm-hmm. So what Ferber means is it's a technique that involves infant sleep problems. So your baby either won't fall asleep independently or they won't stay asleep. Mm-hmm. And so it involves sleep training the child to self-soothe by allowing them to have a premeditated amount of time at small intervals before receiving formal extinction. Yep. So extinction is still involved there, but it takes many days to get worked up to it. And most of the time the child is already sleeping independently and you never actually get there.
Exactly. Yeah.
It's not always 100% that way. Of course, we know this. Every child is different and their response is different. But those were your two options for a very long time, right?
Very long time.
And so when we're on these sleep evaluation calls and we have these first-time families who hear these big words, but they don't know what it is, and it makes them feel unsafe, they come to us hoping there's a even smaller middle ground.
Right, exactly. Something
in between Ferber and the 100% dependence of what they're already doing, right? And that's us, and that's our methodology. You want to share it?
Yeah, and that's the exciting part. I think sleep teaching, right, there's a couple of philosophies that you've spoke to. And we have a philosophy that we like to call gentle and parent-led. So It is dependent on the child. I do like to say that every child is different, and we love to meet the child and the parent where they are. But when we go into working with a family, we are really, our goal is to have and help the child learn the skill of independent sleep while keeping parents present to support their child in the way that the child is asking for that support. So depends on the age of the child and how long we may keep the parent present as the child learns the skill. But nonetheless, we will have the parent present. We will have the parent do the bedtime routine, put down the child fully awake, and then be there to observe and provide various types of support if it's needed, right? We encourage the use of voice. We encourage the use of touch if that's necessary. We encourage space if that's something that the child wants. But the process is really about helping the child learn the skill, but also giving them what they need. And all kids are different. And so we have children that absolutely love the touch, right? They love to be soothed by their parents in that fashion as they learn the skill. We have kids that absolutely will say, no, thank you. I would like a little space, right? And just holding space for them. Their parents doing that can be what they want. But we really want to make sure that we give the children what they need so that ultimately they can learn the skill of sleep, but also feel highly supported, and that the parents can feel like they are going through this process, they're confident, and that they're supporting their child too. Because I think that's one of the number one things when we are talking to parents, and I would say the vast majority of individuals we're speaking with on the phone for the initial call are the moms. And it brings them to emotions, right? Tears a lot of times, to just think that, yes, we know that my child needs sleep. I need sleep. We can't do this anymore. But to kind of step away and allow them to learn that skill, or to even maybe hear them cry, is something that's very emotional for them. So we know this, and because of that, we want to ensure that we have parents present, that we're giving the children support, but still helping them learn that skill, because we know how critical it is for their longevity of sleep quality and their ability to sleep well.
Yeah. And we've also seen the other side of it hundreds of times. So we know that, like, yes, to you, this is your individual experience, and this is the only reality that you know.
Absolutely.
So if you hold our hand and come along with us, we can see the other side of it, and we can help you and guide you and support you as necessary. But truly, we look at 3 different things. We look at our questionnaire to learn as much about your family and your child as possible. We consider heavily off of that what method we're going to go with, whether that does mean being present in the room with the kiddo or checking on them, just depending on there are so many factors.
A lot of factors, yes.
And then we also pay very close attention to the child's temperament and personality and their cries, because the cry is the key here. Unfortunately, we are not in this business to make kiddos cry. Like, that's the worst part of the job. But we also use that as a tool. And I think that makes a lot of families feel better, that even though their child is going to cry, we can take that as information to make it easier for them, so we can meet them where they want us to be.
Right.
And then the crying stops, and then we start to see, progress and what that kiddo needs. So we have a cry scale that we love to go over with every single family, and that we use in our own homes. And I'll run you through it really quick, and you guys can ask yourselves the question of, like, where does my kiddo hang out when they're getting in the car seat? What's their level of cry? What about it around sleep or feeding or diaper changing? And maybe it'll give you a little bit more insight into your child's temperament and personality and how to meet them a little bit easier where they are. So it goes from a 0 to a 6. I know it's not a 10. People don't love that, but we stop at 6 for good reason.
Yeah.
But
we don't want a 10.
You don't want a 10.
No.
A 0 is sleep. They're totally silent. Their eyes are closed. They're sleeping. They're good to go. A 1 is sounds, coos, grunts, groans, whispers, growls, chatter, whatever. They're fine. They could either be transitioning between sleep cycles. They could be in that newborn stage where they are just noisier in general, right?
And still sleeping.
Yep, and still sleeping, but they're keeping that airway clear so they stay alive, which is great. Or it could be them waking up from a sleep cycle. So pay attention to that there. And then a 2 is just a fuss. And when you say fuss, that can be interpreted into
very
a lot of different things. So the way I describe a fuss is it's some sort of volume, wah, and then breath, 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 but the breathing is regulated. They're not gasping. They're not coughing. They're not sucking in all the air around them to pause to scream it all out at a higher octave. Normal, everyday breaths. And then another volume. The volume doesn't matter necessarily. So some babies are kind of lazy and they're like, wah. And other babies can be like, wah, and give you a whole lot and be a little bit louder. That's personality and temperament, right?
It certainly is.
And so when in that case, I would just say, offer a shush, offer a hum, maybe a little pat. They're not really indicating what they want yet, but they're stirring.
Yep.
Okay. A 3 is their everyday average cry.
We hear this a
tears.
lot.
We
Yes.
sure do. There's tears. If they are in their crib, they're probably sitting up, maneuvering around a little bit more, wiggling, things like that. You clearly know they're awake.
Yes.
Okay. But it's steady. Their breathing isn't dysregulated. They're not screaming. It's just a steady cry. Okay. A 4 is a little bit angrier, a little bit more frustrated, which we all can get sometimes, but it's a scream, it's a holler, it's a shout, it's a hello.
I'm here.
Yep. So it's a little bit louder, but it's more frustrated. We hear this a lot with sleep because frankly, when you wake up from a sleep cycle and you're trying to go back to sleep, eventually you get frustrated if it's taking too long.
Exactly.
Right? And then a 5, if they go too long at a 4, they'll hit a 5, which is where they take that big deep breath. They suck in all that air around them.
The purple cry.
It's the purple cry. They're frozen for a second, right? And then when they finally release all that energy and air, it's a shrill scream. Yeah. That is the cry for any mother where we're going through our checklist. They're hurt. They're starving. They've puked. We panic. We go straight into fight, flight, or freeze, and we shut down and we think the worst case scenario, right? It's painful.
Absolutely.
To hear that cry.
Yes.
If a child stays at that elevated cry for too long with no support, they will hit a 6, which is gagging, coughing, puking, holding their breath, hyperventilating. That's the type of cry. It physically pains me to make that sound.
I know. It's literally the worst.
It's the worst. And that is true dysregulation.
Right.
You need to pick that baby up and you need to regulate them all the way back to their baseline. So if you're a client of ours or you're a listener of ours and your baby regularly hits a 5, like some babies live at 5s, folks. And
They exist out there.
They sure do. And you know that that's your baby. And other babies barely get past a whine. Like they're just kind of like, oh, yeah.
I'm here.
But I want you to stop at the 5. There's nothing teachable at a 6
At all.
There's nothing productive there. It's just awful.
Yeah.
So if your baby is truly doing that purple cry, pick them up and calm them all the way down, please, or end the nap or start the day, whatever we need to do. They cannot regulate past that point, and it's cruel to make them.
I think you have to think about yourself a little bit in those spaces, right? We've all been to a place where we are, quote unquote, out of our window of tolerance, right? We might be overstimulated. And you think about trying to learn something in that moment. It's not going to happen for you, and it's not going to happen for them either.
No, they physically can't do it. So we like to really hang out between a 0 and a 3.
Yeah, that's ideal.
That is definitely ideal. Now there are moments where they are going to hit a 4 or a 5, and we have protocols set up for specific babies and what we're going to do. And we try to meet those babies where they are to avoid those levels of cry. But there is truly no sleep training method out there anywhere that doesn't involve crying, because it's how your child communicates their needs.
Correct.
So we would like to use it as a tool to support your child to stop the crying to meet those needs.
Absolutely. Yeah. And sometimes it's just that they are frustrated, and most of the time it is, or protesting a change. I always say change isn't fun if you're 8 days, 8 weeks, 8 months, 80 years old, right? Change is difficult for all of us. There's a process that we go through as we are experiencing change. And so we can't expect that there wouldn't be a little bit of protest or pushback or a feeling of being uncomfortable in that space. And so that's just part of the process. But again, we want to make sure that we're still listening to our children, meeting them where they need to be met through this process and through this change.
100%. So take the cry scale, use it with your own littles. Report back, let us know. Neither of us had level 5 criers really intensely. None of them ever hit that level 5 cry. I only saw when my kiddo was getting shots
or hurt of some sort.
Or hurt of some sort. But little babies, you very rarely experience that unless they truly are colic, and then it's very, very hard to manage. So take those tools from us and see if you can support your baby a little bit easier or quicker, or meet them where they are to get that cry to stop. But don't be scared of the cry. It's normal. It's hard. It sucks, but you can get through it. You can absolutely get through it.
Yeah, and it can tell you so much, too, about your child. And I think another little tip about the cry scale, for mamas, sometimes we overestimate the level of cry. So to us, it sounds like a 5, but maybe it really is more like a 3.
Yeah.
And so when we work with our families, we oftentimes ask the dad or the non-dominant parent to be play a big part in leveling of the cry.
Own that cry scale, if you will.
Exactly. And so that can be very helpful as well. And when clients work with us, we also offer our support on leveling of cries too. But that's another little tip to get your partner involved if they are there.
100%. And to lower your fear about sleep teaching in general, right? Because we've all heard those horror stories of where children have been at a 5 for 6-7 hours. Right. And that will never happen with our program, period.
No, it won't. Yeah, and I think, too, the other one quick thing I just want to say about our method is that we are also thinking about things that are bigger than just the method itself. Yeah. So we're going to be looking at your child's schedule, right? We're going to be looking at their total daytime sleep needs. We're going to be looking at appropriate bedtimes. We're going to be looking at their age, their activity, what they're eating, when they're eating. There's so many things that go into this being successful that I think sometimes when parents are going down the sleep teaching road, they're just going based off the method. Yeah. And there's so many different little pieces that make up the puzzle. And if 1 or 2 or 3 of those are missing, you can go down this methodology and have no success whatsoever.
100%.
And so that's another beautiful thing that I think we bring to the table is that this is more than just the method. Yeah. And that's the wonderful part about what we do and how we meet clients and families.
And also why we have a 97% success rate.
Exactly.
Proud of that.
Exactly. Very proud, for sure.
Yep. Awesome. Well, join us next week where we'll continue to talk about our training with Sleep Sense, and hopefully we'll have a special guest with us at that point to share some more information there. And as we continue with Snoozeworthy, you can keep your eye out for updates on social media, YouTube channel, all the good stuff there, and give us a follow and subscribe. We'd love to have you.
Yes. Thank you.
Bye.